Over 60? Never drink tea with these two foods, destroys iron bones. Tea feels like the safest comfort for many seniors, but pairing it with the wrong foods can quietly harm the body. Doctors warn that tea, when combined with certain meals, can block the absorption of iron and calcium, two nutrients essential for strong blood and strong bones. Over time, this simple mistake can lead to anemia, fragile bones, weakness, and higher risk of falls. For adults over 60, these silent effects are serious because the body is less forgiving with age. Knowing which food should never be mixed with tea is the first step to protecting long-term strength. If staying independent and healthy matters to you, don't miss this guidance. Subscribe now for clear, caring advice designed for life after 60, and share your thoughts in the comments. Together, we'll make sure simple habits, like drinking tea, support your health instead of slowly taking it away. Tea, when consumed alongside iron-rich meals, interferes with the body's ability to absorb one of the most vital minerals for seniors. The compounds responsible are tannins and polyphenols, natural chemicals found in black tea, green tea, and many herbal varieties. These compounds are celebrated for their antioxidant properties, but they also bind strongly to non-heme iron, the type of iron present in plant-based foods and many meats. Once bound, this iron becomes difficult for the body to absorb. For older adults, who already experience reduced efficiency in nutrient absorption, this seemingly harmless habit can quietly worsen iron deficiency. Doctors in geriatric medicine consistently emphasize that anemia is one of the most common nutritional concerns in people over 60. Iron deficiency anemia develops when the body does not receive or absorb enough iron to support the production of hemoglobin, the protein in red blood cells that carries oxygen. Without sufficient hemoglobin, tissues and organs receive less oxygen, leading to tiredness, dizziness, and decreased physical endurance. Seniors are particularly vulnerable because the stomach produces less acid with age, reducing the body's natural ability to break down and absorb nutrients. When tea is consumed at the same time as iron-rich foods, this natural decline is compounded, resulting in an even greater loss of iron absorption. Nutrition researchers have documented the impact of tea on iron absorption for decades. One study published in the British Journal of Nutrition found that drinking black tea with a meal reduced non-heme iron absorption by up to 60%. Another clinical trial noted that green tea had a similar effect, with reductions ranging from 25 to 50% depending on the concentration and timing of consumption. For seniors who may only consume moderate amounts of iron in their daily diet, these numbers represent a significant setback. A single cup of tea with an iron-rich meal can cancel out much of the benefit of that meal, leaving the body unable to replenish iron stores adequately. The consequences of this interaction are not limited to numbers on a lab report. Doctors regularly observe fatigue, pale skin, brittle nails, and increased susceptibility to infection in seniors with iron deficiency. More concerning are the effects on physical strength and mobility. Seniors with untreated anemia often experience muscle weakness, shortness of breath, and slower reflexes. These issues translate into a higher risk of falls and injuries, which are already a leading cause of hospitalization in older adults. By blocking the absorption of iron from everyday foods like spinach, beans, poultry, and beef, tea consumed at the wrong time contributes to a cycle of weakness and reduced independence. The risk of anemia also has implications for the brain. Neurologists point out that low iron levels reduce oxygen delivery to the brain, which can affect memory, concentration, and even mood stability. Seniors who unknowingly combine tea with iron-rich meals may not connect their increased forgetfulness or irritability to this simple dietary mistake. Yet, studies in geriatric psychology show clear links between iron deficiency anemia and cognitive decline. This makes iron absorption not only a matter of physical health but also one of mental resilience. The type of iron consumed plays an important role in how severely tea interferes. Heme iron, found in animal-based foods such as red meat, fish, and poultry, is absorbed more efficiently and is less affected by tannins and polyphenols. Non-heme iron, found in plant-based foods like lentils, beans, leafy greens, and fortified cereals, is far more vulnerable. Because many seniors lean toward lighter, plant-forward diets for heart health or digestive comfort, the reliance on non-heme iron is common. This makes the timing of tea consumption even more important, as combining it with plant-based meals drastically reduces the nutritional return. Medical nutritionists recommend practical strategies for seniors who enjoy tea but want to protect their iron levels. The simplest approach is timing. Drinking tea 1 to 2 hours before or after a meal significantly reduces its inhibitory effect on iron absorption. This allows the body to process the iron in food without interference. Some doctors also suggest choosing herbal teas without high tannin content, such as rooibos or chamomile, during mealtimes, while reserving black or green tea for other parts of the day. These small adjustments make a noticeable difference in maintaining iron status over time. Another factor worth noting is that vitamin C can counteract some of the inhibitory effects of tea on iron absorption. When consumed with meals, vitamin C helps convert non-heme iron into a more absorbable form. Clinical studies show that a glass of orange juice, or adding citrus fruits and bell peppers to a meal, can restore much of the iron absorption lost when tea is consumed nearby. However, this strategy does not fully eliminate the problem, especially in seniors with already low iron stores. Doctors caution that timing remains the most effective method of prevention, with vitamin C acting as an additional support rather than a complete solution. The seriousness of this issue becomes clearer when looking at population studies. Surveys of older adults show that those who regularly drink tea with meals are more likely to have lower hemoglobin levels compared to those who separate their tea from food. In regions where tea is a cultural staple, such as parts of Asia and the Middle East, public health campaigns have advised against pairing tea with iron-rich meals, especially for children, pregnant women, and seniors. These guidelines are grounded in decades of nutritional research confirming the strength of the tea-iron interaction. Doctors also note that seniors who are already on medications for chronic conditions may be at higher risk. Certain drugs, such as proton pump inhibitors used for acid reflux, further reduce stomach acid and impair iron absorption. When combined with the effects of tea, the likelihood of iron deficiency rises sharply. For seniors managing multiple medications, this makes it even more critical to avoid drinking tea alongside iron-rich foods. Clinical dietitians often stress the importance of coordinating meal and beverage timing with both nutrition and medication schedules to ensure that absorption is maximized. The progression of iron deficiency anemia can be gradual and easy to overlook. Fatigue may be attributed to age, dizziness to blood pressure medications, and weakness to lack of exercise. In reality, these symptoms may stem from poor iron absorption caused by something as simple as tea at the wrong time. Some geriatric specialists highlight this interaction as one of the most underestimated contributors to functional decline in older adults. Addressing it is straightforward: shift tea to a different part of the day, away from iron-rich meals, and the body can regain its ability to use iron more effectively. Another area where research provides insight is the difference between black tea and green tea. While both contain tannins and polyphenols, black tea generally has higher levels of these compounds, making it slightly more inhibitory to iron absorption. Green tea, though somewhat less impactful, still reduces absorption significantly when paired with meals. Herbal teas vary widely depending on their content, with some posing little risk and others acting much like traditional teas. Seniors who prefer strong black tea with meals, particularly breakfast or dinner, face the highest risk of impaired iron absorption. The importance of addressing this interaction goes beyond preventing anemia. Strong iron status supports immune function, wound healing, and overall energy levels. For seniors recovering from surgery, illness, or injury, iron deficiency delays healing and prolongs recovery time. Doctors working in rehabilitation settings often observe that correcting iron intake dramatically improves patients' ability to regain strength and mobility. Avoiding tea during iron-rich meals is therefore not only preventative but also supports healing in times of stress. Research published in the Journal of the American Dietetic Association showed that even moderate tea consumption with meals led to measurable decreases in iron absorption in older adults. Participants who adjusted their tea habits by moving it away from meals improved their hemoglobin levels within weeks. These findings confirm that the solution is practical and effective, requiring no elimination of tea, only better timing. Seniors do not need to give up their daily ritual of tea drinking but should simply ensure it complements rather than undermines their nutrition. In conclusion, drinking tea with iron-rich meals blocks one of the most essential nutrients needed for energy, strength, and resilience in seniors. The tannins and polyphenols in tea bind with non-heme iron, preventing proper absorption at a time when older bodies already struggle to process nutrients efficiently. The result is increased risk of anemia, fatigue, weakness, cognitive decline, and higher fall risk. Doctors and nutrition experts recommend keeping tea at least 1 to 2 hours away from iron-rich meals to protect health. Adding vitamin C-rich foods during meals provides additional support, but timing remains the most reliable solution. By making this simple change, seniors can continue to enjoy the comfort of tea without sacrificing the iron that keeps their blood strong and their bodies resilient. Tea, when combined with calcium-rich foods, interferes with the body's ability to maintain strong bones, something that becomes increasingly critical after the age of 60. The compounds in tea that create this problem are oxalates, naturally occurring substances that bind to calcium in the digestive tract. Once bound, calcium is not absorbed into the bloodstream but instead passes out of the body unused. While this may sound like a small issue, the effects accumulate over time. Seniors already experience lower bone density due to hormonal changes, reduced physical activity, and slower nutrient absorption. When tea prevents calcium from being properly absorbed, the risk of osteoporosis, brittle bones, and fractures rises significantly. Doctors warn that bone loss in older adults often happens silently until a fall or fracture exposes the weakness. This is why nutritionists stress calcium intake as one of the pillars of senior health. Calcium is necessary for more than bones. It supports nerve transmission, muscle contraction, and normal heart rhythms. However, the protective effect of calcium only works if the mineral actually enters the bloodstream and is stored in bone tissue. Drinking tea with calcium-rich foods such as milk, yogurt, cheese, or leafy greens blocks this process. A glass of milk with tea, or tea taken right after a calcium-rich meal, cancels out much of the benefit of those foods. Research confirms the strength of this interaction. A study published in the Journal of Nutrition and Metabolism reported that oxalates in black and green tea can reduce calcium absorption from dairy by up to 25%. Over months and years, this reduction contributes to cumulative bone loss. Seniors who rely on calcium to maintain bone density, especially women after menopause, are most at risk. Doctors who treat osteoporosis often highlight tea timing as an overlooked factor in patients whose bone density does not improve despite adequate calcium intake. The habit of drinking tea alongside calcium sources can explain why supplementation sometimes appears ineffective. The impact extends beyond bones to the muscles and heart. Calcium plays a key role in muscle contraction, including the heartbeat. Low calcium absorption over time leads to muscle cramps, irregular heartbeats, and increased risk of arrhythmia. For seniors already managing heart conditions, this additional burden can complicate treatment. Cardiologists caution that maintaining consistent calcium levels is essential for heart stability, and tea interfering with absorption creates hidden fluctuations that may not be obvious until symptoms appear. The situation becomes more complex because tea also contains caffeine, which increases calcium excretion through urine. This means that tea not only blocks calcium absorption in the gut but also encourages the body to lose more of the calcium it already has. Seniors, who typically consume less dietary calcium than younger adults, cannot afford this double effect. Researchers estimate that each cup of caffeinated tea or coffee increases urinary calcium loss by a small but significant amount. When combined with reduced absorption, this creates a steady decline in calcium balance. Orthopedic specialists treating seniors for fractures often point out that small habits like drinking tea with meals add up over years. A hip fracture in older age is not always caused by a single fall but by decades of slow bone weakening. By unknowingly combining tea with calcium-rich foods, seniors may unintentionally accelerate this weakening. The effects are compounded by other factors common in aging, such as vitamin D deficiency, reduced sunlight exposure, and decreased mobility. This makes it essential to protect every bit of calcium consumed, rather than allowing tea to interfere. Practical strategies are simple yet powerful. Doctors recommend spacing tea at least 1 to 2 hours away from calcium-rich meals or supplements. This timing gives the body a chance to absorb calcium fully before oxalates from tea are introduced. Seniors who enjoy tea with milk, a common practice in many cultures, are advised to adjust by drinking tea separately from their dairy intake. Herbal teas that are naturally low in oxalates, such as rooibos or chamomile, may be used during meals instead. These options allow seniors to maintain the comfort of tea without sacrificing calcium absorption. Studies also highlight that not all teas affect calcium equally. Black tea and certain green teas contain higher levels of oxalates, while white tea and lightly brewed herbal teas tend to have lower amounts. However, the inhibitory effect is still present to some degree, especially when consumed frequently. Seniors who drink multiple cups of tea daily alongside meals face the highest risk. Nutritionists suggest keeping stronger teas for mid-morning or mid-afternoon, well separated from breakfast or dinner, when most calcium-rich foods are consumed. The relationship between tea and calcium is especially concerning for women over 60. Postmenopausal women lose bone density more rapidly due to hormonal changes, and their risk of osteoporosis is already elevated. Studies in women's health journals show that high tea consumption during meals correlates with higher rates of hip and spine fractures later in life. Doctors working in osteoporosis clinics consistently find better outcomes in patients who adjust tea timing compared to those who continue the habit of combining it with calcium. It is also important to note that calcium absorption is not only about bones but about independence. Seniors with stronger bones are less likely to experience fractures that limit mobility. Every year, thousands of older adults lose their ability to live independently due to hip fractures. Preventing these injuries is not only about avoiding falls but also about strengthening the bones in advance. Protecting calcium absorption by keeping tea separate from calcium-rich foods is one of the simplest preventive steps seniors can take. Geriatric dietitians frequently explain that calcium intake recommendations for seniors are higher than for younger adults because absorption declines with age. Yet, if tea consistently blocks part of this intake, even higher recommendations may not meet the body's needs. Some seniors take calcium supplements to reach these targets, but drinking tea at the same time can reduce the effectiveness of supplementation. Doctors advise treating supplements with the same care as meals, ensuring that tea is taken at least an hour apart. This small adjustment can make the difference between supplements working or failing. The interaction of tea and calcium also affects dental health. Calcium supports strong teeth, and reduced absorption increases the risk of tooth decay and gum disease in older adults. Dentists note that seniors with osteoporosis often show weaker teeth as well, underscoring the connection between bone and dental health. Protecting calcium intake by adjusting tea habits not only strengthens bones but also supports oral health, reducing the need for dental procedures that can be complicated in later years. In conclusion, tea combined with calcium-rich foods prevents the body from absorbing a nutrient essential for strong bones, steady heart rhythms, and overall independence in older age. Oxalates in tea bind calcium in the digestive tract, while caffeine promotes calcium loss through urine. Seniors already face reduced bone density, making this interaction particularly harmful. Research and clinical practice both confirm that drinking tea with dairy, leafy greens, or calcium supplements undermines the intended benefits of these foods. Doctors and nutritionists recommend spacing tea 1 to 2 hours away from calcium intake, using herbal alternatives at mealtimes, and reserving stronger teas for between meals. By making this change, seniors can enjoy tea daily while protecting the calcium their bodies need to stay mobile, strong, and independent. Safe tea timing allows seniors to enjoy their daily cup without losing vital nutrients. Doctors recommend waiting at least 1 to 2 hours after eating before drinking tea, especially when meals are rich in iron or calcium. This simple spacing gives the body enough time to absorb these nutrients before the tannins, polyphenols, and oxalates from tea interfere. For seniors who are used to having tea with breakfast or dinner, a practical adjustment is moving it to mid-morning or mid-afternoon, when the stomach is less focused on absorbing minerals. This habit not only preserves iron and calcium but also helps maintain steady energy throughout the day. Some alternatives can be enjoyed safely with meals. Herbal teas like rooibos, chamomile, or peppermint contain little to no tannins or oxalates, meaning they do not significantly block nutrient absorption. These options provide comfort, hydration, and flavor without reducing the benefits of calcium or iron-rich foods. Seniors who prefer warmth with their meals may find these choices both satisfying and protective. The key message is that tea itself is not harmful, it is the timing and pairing that matter. By keeping traditional teas away from iron and calcium sources, and using gentler herbal teas during meals, seniors can continue enjoying the ritual of tea drinking while protecting bone strength, blood health, and overall resilience. Small adjustments in timing ensure that tea remains a pleasure, not a silent drain on vital nutrients.